Hi, I'm Dr. Christopher Rapuano, and I've been at Wills for a long time. I started as a resident here in 1987, did a one-year fellowship at the University of Iowa with actually an ex-Wills Cornea Fellow, and then came back on staff in 1991. I'm currently the chief of the Cornea Service. What I like best about my job is that I get to do a variety of things. I get to see patients, I get to do surgery, I get to teach residents and fellows, both seeing patients and doing surgery. I get to do research with the residents and fellows, and I get to lecture both locally and internationally, and get to write chapters and papers and books. What I really probably most enjoy is teaching the fellows. That's really kind of what makes me tick and what makes me come to work every day.
Hi, I'm Kristen Hammersmith. I have been here at Wills for almost 20 years. I got here from the Other W place down the street in Baltimore, where I did my residency training. And then I came to Wills, and I guess I've never really finished my fellowship because I haven't left. And I've been doing the management of the fellowship really since I started in practice, or a few years after. We have an incredible fellowship. I think it has a really amazing mix of great surgical experience and really sick, complicated corneas. We like to call it the extreme cornea place. So our fellowship we think is second to none, and we would be excited to share it with you.
My name is Brandon Ayers. I am one of the co-directors of the Cornea Fellowship at Wills Eye Hospital. I did my fellowship about 15 years ago, and here at Wills Eye Hospital, and I stayed on the cornea service ever since. I absolutely love what I do. I have fun every day, seeing patients, spending time with the fellows every day, spending time in the OR several times a week with the fellow, learning surgeries, talking about patients and clinical care. I've been at Wills for the past 15 years for a couple of reasons. One is I love Philadelphia. Two is, why would I go anywhere else? I think we have some of the best clinical staff. I know we have some of the best clinical staff in the entire world. Why on earth would I go someplace else? I get to see the most interesting patients with the smartest people, with the best fellows every day. I am a pig in mud, at this point with what I just can't say enough about the fellowship. I love it. I was a fellow here. My mission is to try and make this fellowship one of the most attractive and most enjoyable years a fellow would be able to spend, whether it's eating burritos or talking about surgery or doing surgery. It's a lot of fun, and my life is better because of it.
Hi everyone, my name is Zeba Syed, and I am the Cornea Fellowship Co-Director here at Wills Eye Hospital. I've been at Wills Eye for about 2 years. I did my residency at Mass Eye and Ear, and then my Cornea Fellowship at Bascom Palmer, and came here immediately after. I think what makes Wills special and unique is the huge wealth of resources here. Being at Wills, we are surrounded by some of the brightest minds in ophthalmology, and these are the people who we can turn to help us take care of our patients and to generate research ideas. So it's a huge collaborative environment with so much academic potential, and our fellows come up with great research ideas that they pursue over the course of the year. What I find most fulfilling about my job is actually watching you guys, the fellows, grow over the course of the year. So you start off in July, perhaps not having done much cornea surgery, learning the steps of transplants, and by the end of the year, or even much sooner than that, you guys are teaching residents how to do these surgeries. You guys are pretty independently performing transplants and doing the vast majority of cornea surgeries, and that to me is what I love about my job, watching you guys grow over the course of the year and becoming independent and very competent cornea surgeons. So thank you guys for joining us, and I'm looking forward to meeting you over the course of the interviews.
I'm Irving Raber. I'm the oldest and most senior member on the cornea service at Wills, where I've been an attending surgeon for the past 35 years. I really enjoy my interaction with the residents and fellows. They keep me on my toes and always make sure that I'm doing the right thing. I enjoy watching them mature throughout the year, both as a clinician in the office and as a surgeon in the operating room. And now that I've stopped doing intraocular surgery, my main exposure to the fellows is in the office, where I try to sharpen their observational and diagnostic skills.
Hi, my name is Dr. Biren Megpara, and I've been here at Wills for just over 6 years. I did my fellowship at the University of Colorado, and I did my residency at Baylor in Houston, Texas. At Wills, I am the co-director of refractive surgery, and one of the fun things that I do get to do is I'm one of the team ophthalmologists for the Philadelphia Phillies. What I really like most about Wills is the ability to teach and work with the residents and the fellows. And personally, it's opened up a lot of neat opportunities to do fun things, like working with the Phillies, working with different companies and industry, lecturing around the country and around the world. I think the strongest thing about our fellowship is the surgery. We've got so many great attendings, and the quality, the quantity, the diversity of surgery here, I think, is second to none. Hope you enjoy your day here, and looking forward to meeting you soon.
Hi, my name is Parveen Nagra, and I'm on the Cornea service at Wills Eye. I started at Wills as a resident and then continued on in my fellowship at Wills. After I graduated from my fellowship, I did join the service briefly and then moved away for a few years. In 2010, I moved back and have been a member of the Cornea service and actively involved in the fellowship since then. Probably the biggest strength of our fellowship program is the number of attendings in the faculty. The benefit of working with so many different attendings is we all have a slightly nuanced approach to treatment of different corneal and external disease conditions, both clinically and surgically. And the ability to work with different attendings is really a highlight of our program.
Hello, my name is Brent Finkley. I am on the Cornea service at Wills Eye. I was a resident at Wills back in 2014 to 2017. After which time I did a fellowship in academic global ophthalmology at Wills as well, and a subsequent fellowship in cornea and external disease at the Duke University Eye Center. I've been back in Philadelphia since 2019, working on the cornea service with our residents and fellows, and have really been having a wonderful experience. So we're excited to have you interviewing for this role in the fellowship program. One of the things that makes Wills unique is our split model between the academic programs at Wills Eye proper and at our private practice, Ophthalmic Partners of Pennsylvania. Because of this division, you get to spend 2/3 of the time working in a highly academic setting, and then a third of the year working in the private practice, where you can be exposed to a high efficiency model, learn a little bit more about the practice flow patterns, and then also get to work at our ambulatory surgical center. The split model also gives the opportunity to see a lot more a complex anterior segment in addition to standard cornea with grafts and ocular surface management. And so we are excited that you're able to leave our program with a ton of tools in your tool belt, able to tackle just about anything that's going to come your way.
Hi, I'm Aditya Kanesa-thasan, and I'm the newest addition to the Wills Eye Cornea faculty. I did my residency here and then came back after fellowship. I feel really lucky to be a part of the Wills Eye Cornea service. You'll notice that this is a really special place as soon as you get to talk to the faculty. One of the things that make us really special is the amount of experience and diversity of experience on the faculty. Even if there's something really rare, you can guarantee that someone's treated it or seen a patient with it or even written a case report about it. So you really get a chance to see the full breadth of corneal pathology here. Personally, I'm really interested in things like keratoplasty and particularly secondary IOLs, like Yamani technique, Lude technique, or suture. And I also really enjoy trying new medical devices and evaluating them. I'm really excited to get to know you guys, and hopefully you get to know what we're all about.